Hi, this is your 7-month post-op video. So hopefully by this time you are starting to, or have already really gotten into a good routine with your vitamins, minerals. You're easily meeting your minimum fluid recommendations of 64 ounces a day, hopefully even getting closer to 80 or 90 ounces. You're probably still, working on your protein, but hopefully, more of those fruits and vegetables are really becoming kind of the foundation of your diet and your meal choices. At this point, you're likely still losing weight, but potentially that weight loss has really slowed down. And so this is kind of the time period that I like to call the honeymoon is over, or the ending of the honeymoon. You're still losing weight, you can still lose weight, but you're probably not having those, dramatic 5 pounds in a week or 15 pounds in a month. It's probably more along the lines of 1 or 2 pounds a week, or maybe 2 to 3 pounds in a month, or maybe you're even having some weight loss stalls where you're going several weeks to a month or so and not having a significant weight loss. That is all normal and to be expected. Again, this is, like I said, the kind of the end of the honeymoon. Now, this does not mean that you are done losing weight or that you are not going to hit your goal. That can still happen. That likely will still happen. But at this point, it really becomes more and more dependent on you and the choices that you make day in and day out for your kind of long-term weight loss success and maintenance. And so this is really when that surgery really just becomes a tool again. And just the way that you cannot build a house with only using a hammer, you cannot lose weight and have a healthy life with just a surgery. It really becomes about the foods that you put in your body, when you're eating, how often you're exercising, your stress levels, how well you're sleeping. All of these things are tools that your body uses to lose weight and to maintain that weight loss and to really be your healthiest self. So I think that's just kind of a really good thing to keep in mind. We're not designed to lose, these significant amounts of weight for months and months and months and months on end. Now, some of you, especially if your BMI was, over 40, potentially even over 50, the more weight you had to lose to get to your goal weight, typically kind of the longer your honeymoon is, and that's simply because you do have more weight to lose, and so it tends to come off a little bit easier. But again, everyone is a little bit different with the rates and kind of when this honeymoon phase sort of does come to an end. So again, it is expected, it is normal. If you have any questions or get frustrated by it, you can always go to our Facebook page and the support group there. We're always happy to kind of help answer questions and just sort of field those concerns. So the other thing I want to talk about at this point is gallstones. And so gallstones are essentially kind of the hardened deposits of digestive fluid that can accumulate in your gallbladder. Now, being obese and losing a significant amount of weight in a short period of time, whether it was with surgery, as in our case, or without surgery, puts you at greater risk of gallstones. So people that have had surgery typically experience maybe the signs and symptoms of gallstones around 6 months to 23 months post-op. So we're just kind of at the beginning of when most people might notice symptoms. So some things to kind of notice or to pay attention to if you have any sort of sudden intense abdominal pain, specifically sort of in that right upper quadrant of your abdomen. If you have any chest pain or pain kind of around your breastbone or under your sternum, to pay attention to that, or any pain in your shoulders or in your back as well. Those can all be signs of gallstones. So anytime that you experience any sort of significant pain or have any questionable signs and symptoms, it's always important to really call your doctor And if significant enough, or if you're just concerned enough, obviously always go to the emergency room or seek immediate medical attention, whatever is best suited for your specific situation. So there you have it, some suggestions and some tips for your 7-month post-op point. So let us know, is that honeymoon weight loss phase still going strong for you? Or can you tell that the honeymoon is beginning to come to an end? Comment in the section below, and please remember to like and share this video.